Hey guys, I am the Nurse Doc Tutor, and we will be going over intake and output calculations today. So before we jump into the actual examples, I'm going to explain some little things about intake and output. Alright, so what is actually considered intake? So intake is going to be oral fluids and liquid foods. So one of the big things is to remember anything that is left at room temperature, if it melts down to a liquid, we're going to include that in our intake. We got IV fluids, we got IV flushes, we got catheter irrigants. So meaning if a patient was getting continuous bladder irrigations, if we're flushing that patient's suprapubic catheter, if we're flushing that patient's tube, NG tube, then if we're flushing that patient's PEG tube, all those things are going to be considered intake. So what is actually our output? So output is urine, blood, emesis, diarrhea, any tube drainage, wound drainage, fistula drainage. So like let's say a wound vac, if the patient has chest tube drainage, anything that is draining from the patient, that would be the drainage that we would count for our output. Okay, so this slide right here is very important. So your intake is going to be measured in mLs. Your output, normally that already comes in mLs, but your intake, you're going to have to convert it to mLs. So if you don't know your conversion factors, here is it right here. Also, remember, the ice chips should be recorded as half of their volume. So if you have 8-ounce cup of ice, when that ice melts down, you're going to have 4 ounces of water, okay? So you want to make sure that you keep that in mind. Let's jump into our first example. So the problem says we have 6 ounces of coffee. So what we want to do is we want to go ahead and draw us a little chart is what I like to do. So I like to put intake on one side, and then I like to put output on the other so we can keep it all together. All right. So it says that we have 6 ounces of coffee. So we know that 30 mLs equal 1 ounce. So remember, your answer has to be in mLs. So we're going to do 6 times 30, and that gives us 180 mLs. All right. Next, we have 50 mLs per hour of an IV infusion, but it's only running from 7 o'clock to 8 o'clock. So that's only 1 hour, so that's only 50 mLs. All right, we next have 9 ounces of apple juice. So we're going to take 9 times it by 30, because 30 mLs equal 1 ounce, and we're going to get 270. All right, so we then have 9 ounces of bran flakes. So that's cereal, so we're not going to count that part, but we're going to count the half a cup of milk. So we know that 1 cup is 240 mL. So we're going to divide that in half, and we're going to get 120 mLs. All right. Next, we have 2 pack of red blood cells that are 250 apiece. So 250 times 2 will give us 500. You guys, it is so important to pay attention when it says more than one quantity. All right, and then we have a can of ginger ale. So it lets us know right here that this can is 12 ounces. So we then going to do 12 times 30, which we'll get 360. So let's then add all that up together, and you will get 1,480 mLs. How did you guys do on that one? All right, so let's begin our second problem. So as you can see, this one is a lot more busier. All right, so at 8 o'clock, they had 2 pieces of toast, 2 cups of oatmeal, 8 ounces of yogurt, 12 ounces of orange juice, and 2 ounces of grits. So the only thing we're going to take out of there that is going to be considered our intake is going to be the 12 ounces of orange juice. So remember, we have to be in mL, so 12 times 30 will give us 360 mLs. All right, next we're going to go to 10 o'clock. They had 2 8 ounces of coffee with 2 ounces of cream in each. So 1 coffee is 8 ounces, and if we add the 2 ounces of cream in it, that's going to give us 10 ounces. But we did that twice. So we're going to do 10 ounces times 30. And we get 300 mLs, and then we're going to times it by 2 because they had 2 of those, right? All right. So then the patient had, at 11 o'clock, they had 24 ounces of ice chips. So right here, we want to make sure that we divide it in half. So they had 12 ounces of ice chips, so 12 times 30, 360. All right. So then they had an IV infusion of Zosyn, which was 50 mLs. Then they had 2 mLs IV push of Zofran. And then they had a 10 ccc flush. So remember, cc is the same as ml. So there's no conversion needs to be done. And then they had 500 mLs of urine. So we're going to put that on our output side. All right, so then the patient at 12:30, they had a house salad, a 12-ounce soda, and 3 12-ounce popsicles. So we're going to start with the 12-ounce soda. That gave us 360. And then we had a 12-ounce popsicle, which is 360. But guess what? We had 3 of those. So we're going to get a total of 1080. So remember to pay attention to the quantity. Then they had 1 pack of red blood cells, which was 250. Then the patient had a morphine injection, which was 2 mLs. And then they had a 10 ccc flush. All right. So then after that, they had another 10 cc flush. And then at 1600 to 1900, the patient had a continuous IV fluid of 100 mLs. So from 16 o'clock to 19 o'clock is 3 hours. So we're going to do 3 times 100, which will give us 300 mLs. All right. And then the patient had 1,000 mLs of urine. So we're going to go ahead and start with our output since we're over here first. Add that together and we get 1,500 mLs. And then when we add all this up, we get 3,394 mLs. Did everyone get that right? All right, so I hope this presentation made understanding intake and output easier for you. Thank you for watching.